Alrighty, here we go. Hello, and thank you for watching this program on OIG compliance for chiropractors. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. Let me tell you a little bit about myself before we get started here. My name is Dr. Marty Kotler. I am a chiropractor. I'm also certified in CPT coding. I'm a certified professional compliance officer. I've written many books on chiropractic billing, coding, and documentation. I write articles for chiropractic economics and dynamic chiropractic. I write articles for many state association newsletters throughout the country. I've done seminars in front of over 3,500 chiropractors and staff members over the last 10 years. I'm a speaker for the Coding Institute, Parker Seminars, Foot Levelers, and I'm a guest speaker at many state association conventions nationwide. I'm going to be appearing at many state associations this year, so you might want to come and check out one of my lectures. All right, so OIG stands for Office of Inspector General. Now they have a mission, one mission, and that's to protect the integrity of the Department of Health and Human Services, also known as HHS programs, as well as health and welfare program beneficiaries. So what does that mean? The OIG, the goal of OIG is to protect federally funded programs. Well, guess what? Medicare is one of those examples. Medicare is a federally funded program, and chiropractic is a covered service in the Medicare program. So right away, we have the connection here between OIG and Medicare. Now, because the OIG's mission is to protect Medicare and these federally funded programs, they do reviews, they do analysis, they do audits to see how things are going. Well, there have been 8 OIG reports on chiropractic over the last, 10 years. And, they all pretty much say the same thing. This one's many years ago, talks about chiropractic services in the Medicare program. Not a good report. Here's another one, inappropriate Medicare payments for chiropractic services. This is from May 2009. This one was focused on one provider, and it showed how billing was out of control. Here's another one showing that Medicare payments were provided inappropriately. And, I'm frustrated with all of these reports because many state associations and national chiropractic associations put on seminars and webinars on chiropractic record keeping and Medicare billing and coding. Companies like mine travel throughout the country teaching chiropractors how to bill and code and document properly. But yet, with all that education, all that work and effort getting put out, we're still getting these negative reports. I don't get it. I don't understand it. There's another one. CMS should use tactics to curb questionable, inappropriate payments for chiropractors. This one was focused on one chiropractor, a Michigan chiropractor, receiving a lot of money for inappropriate services, and most of the time it's for wellness or maintenance services that Medicare considers not medically necessary. And this is the most recent one you see on your screen. This one says hundreds of millions in Medicare payments for chiropractic services did not meet with Medicare requirements. This is not that long ago, from October 2016. This one just did not make sense to me. What this report said was that in 2013, I don't know if it was 2013 or 2015, I think it was 2013, Medicare paid out $438 million to chiropractors. Just rounding off the number, $438 million were paid out to chiropractors in the year 2013. So an analysis was done on that. So if you look at $438 million divided by about $30 a visit, that's what my calculations come out, Medicare pays about $30 a visit. So you do 438 million divided by $30 per visit, it comes out to about 17 million visits. So Medicare paid for 17 million visits, and now they want to take a look and see, were those visits paid properly? Did we overpay? Did we underpay? So an analysis was done, but the analysis to me just didn't make sense. So like I said, 17 million visits were paid. So now OIG is going to do an analysis. How many visits you think they looked at to make a determination? You know, I'm not an expert in research methodology. I don't have my PhD in this, but it just didn't seem to make sense. So I don't know. When I do this seminar live in front of an audience and I bring this up, out of 17 million visits, how many you think would have been a good idea to look at to see if we were documenting properly? Most people go 10%. 10%. So that would be 1.7 million visits that Medicare should look at to determine if we are billing and coding properly. Well, they didn't look at 10%. They didn't look at 5%. They didn't look at 1%. Out of the 17 million visits, they looked at 105 visits. That's it. 105 out of 17 million visits. That's like 0.00000000006%, something like that. And out of the 105 visits, they broke it into 3 categories. Category 1 were patients that had 1 to 12 visits. Category 2, patients that had 13 to 30 visits. And Category 3 was, or Group 3, was patients that had more than 30 visits, or more than 31 visits. So in Group 1, out of the 35, each group there were 35 visits. So that's where we get the 105. 3 groups, 35 each, 105. Group 1, 26, not good, 9 were good. Group 2, 2 met medical necessity, 33 did not. In Group 3, 0 met medical necessity, and 35, all 35, were considered medically unnecessary. So out of the 105, 11 were good. This translates into an 82% error rate. So Medicare does the calculation and they go, well, we paid out $438 million. According to our analysis, 82% was incorrect, so that means we inappropriately paid chiropractors $358 million. Again, it just, with all the education, with all the stuff that's out there, I just find these reports to be very frustrating. I just don't get it. Now, in this report, there were some other items here that are very important. You should get a handle on this. You could just Google it. You could find it pretty easily. And CMS, comments on their recommendations that the OIG provided, and it says CMS stated that the Medicare Access and Chip Reauthorization Act, that's also known as MACRA. You may have heard that term. It's an acronym, MACRA. It's a law that went into effect in 2015, and it requires prior authorization for specific chiropractic services furnished on or after January 1st, 2017. By a chiropractor whose billing pattern is aberrant and for episodes that included more than 12 visits. So there's this connection here between OIG, Medicare, and now MACRA. There's also something called a comparative billing report that many of you might have received. You should look at these. Take a look and see how you compare. Take a look at your statistics. Now, when treating federally funded program patients, an OIG compliance is required. OIG compliance is required if you treat Medicare, Medicaid, TRICARE patients, any other federally funded program patients. So, OIG compliance is required. Here's the question. What constitutes OIG compliance? You know, some doctors I talk to, they go, well, Marty, we go to Medicare seminars and we document properly. I think we're compliant. You know, does that make you compliant? Probably not. I'll tell you why in a few minutes. You got to do more than just say, well, we go to seminars and we feel like, we do things right. So what is OIG compliance? How do you know if you are compliant? Well, the main purpose of OIG compliance is to educate providers and your staff members on how to prevent billing and coding errors. That's the main purpose of an OIG compliance plan in your practice, is to prevent fraud and abuse. So I was talking about this connection. You have the OIG, Office of Inspector General. Well, they comment on Medicare. Medicare also was related to MACRA. Because of the new law, the Medicare payment system has changed. One of the changes equates to MIPS. MIPS, that's a merit incentive-based payment system that Medicare is now using. There's no more PQRS, there's no more certified EHR. Everything's been segued, rolled into MIPS. And then within MIPS, there are certain things that you need to do if you qualify for this incentive program. One of them is a security risk assessment. Well, a security risk assessment is part of HIPAA. So you have this connection here between OIG, Medicare, MACRA, MIPS, and HIPAA. So my recommendation is, if you presently have a OIG compliance plan, or you're thinking about getting one, these rules should apply to all health plans. You could look at it that way, because OIG is really geared towards federally funded programs. But if you're not doing things right, and Blue Cross Blue Shield, Cigna, Aetna investigator comes knocking on your door, well, you should apply these compliance rules and policies towards all insurance companies. Now, getting paid for services that are not medically necessary, that could be considered fraud and or abuse. And, that's where a lot of doctors, they get very nervous if they feel like they've been accused of billing fraud. But if you get paid for a service, if you submit a claim to an insurance company and it looks like it's wellness maintenance and you got paid for it, well, is that fraud? Probably not. See, fraud is that you're doing something wrong and you continue to do it. Abuse is you're doing something wrong, but it was just a simple, maybe you want to call it honest mistake. You could still get in trouble. So services that are medically necessary is what a health plan will pay for. When you look at any health plan, Medicare, Blue Cross Blue Shield, many of them cover chiropractic. And they say chiropractic is a covered service. It is a benefit in the health plan as long as the services are medically necessary. Now that's the challenge for a lot of chiropractors. Well, what is considered medically necessary? A patient comes in, they lie down on the table and I palpate them and they have a subluxation and I adjust the subluxation. Isn't that medically necessary? Maybe, maybe not. That's where you need to gather the medical policies on all the insurance companies that you bill, including Medicare and Blue Cross Blue Shield. So medical necessity. You need to know what constitutes medical necessity. Now, where do you go to find out what is medical necessity? Well, here's one definition. This is right from CMS. Here's the definition of medical necessity. A service treatment that is required to identify an illness or an injury. It's consistent with the symptoms and or diagnosis. It's appropriate under the standards of care. It's not solely for the convenience of the participant, the physician. It's the most appropriate service, treatment, procedure which can be safely provided to the patient and accomplishes the desired end result in the most economical manner. The services items being provided must be reasonable and necessary for the diagnosis or treatment to improve function. You could use that as your basis for determining medical necessity. So if you think about my example, patient comes in, is totally asymptomatic, no pain, no discomfort. They have normal activities of daily living. They lie down on your chiropractic table. You palpate, you find a subluxation, you adjust it. Is that medically necessary according to insurance? Probably not. So when it comes to compliance, here's a question for you. Can you provide proof that you've made an effort to prevent fraud and abuse? See, most chiropractors, I deal with thousands of chiropractors over the last 10 years. I have a couple of hundred clients across the country. 99% are good guys and gals. They mean well. They want to just do a good job and get people better. And they feel like I'm a good guy. I feel like I'm doing things right. But if Medicare came knocking on your door, how do you prove to them that you're a good guy? How do you prove that you're doing the right thing? By verbally saying, well, we're good people. We're very honest. That doesn't work. You have to provide proof. Here's the question on the screen. Can you provide proof that you've made an effort to prevent fraud and abuse? Can you provide proof in writing? So, where do you start? A compliance program should be based on the requirements and suggestions for compliance from the OIG guidance. The OIG, many years ago, they put out a guidance on how a compliance plan should be put together. And they provided 7 essentials. Here they are, 7 fundamentals. Number 1, written policies and procedures. I say this all the time, but yet 95% of the doctors I work with do not have any written policies and procedures on prevention of billing, fraud, and abuse. Number 2, conduct regular staff trainings. Many of the doctors I speak to go, Marty, sure, we do staff trainings all the time, at least once a month, sometimes once a week. I have some clients where they have a staff meeting every day in between shifts. They have like a team huddle before every shift. So if I asked one of those chiropractors, do you have staff meetings? They all say yes. But do you write down that you have a staff meeting? Do you keep a log of those meetings, who attended and what the topic was and the date? Next, create open lines of communication. You always have to give that impression in your practice that you're creating a culture of compliance. You need to designate someone as a compliance officer. I know some staff members, they're resistant to being named a compliance officer. Doctors, if you can't find an office manager or somebody to be the compliance officer, just name yourself. It's not a big deal. Somebody needs to be named the compliance officer. Conduct internal audits. That means you're looking at your own records. These are the things you must do. So again, if I asked 95% of the chiropractors, do you conduct your own internal audits? Many of them say, yeah. Do you have it in writing? Do you have a formal tool? Do you have anything where somebody could look at and see what you're doing? Most say no, we don't have that. 6, respond promptly to detected offenses and take appropriate corrective action. And number 7, enforce proper disciplinary practices. How do you discipline staff members? That should be in writing. Let me give you a few examples of policies and procedures. Here's one. Procedure and policy number 1.1, OIG exclusion and background check. So let's say you are a chiropractic practice, you're booming, you're doing great, you're packed, and now you want to hire an associate chiropractor to work for you. And this associate chiropractor is going to see Medicare patients. Medicare states you are required by federal law to put that associate doctor's name into the OIG exclusions list. There's a website, there it is right on your screen, exclusions.oig.hhs.gov. Go there, put your name in, see if your name pops up. If it doesn't, it says we did not see your name on the list. Print that out, put it in your policy and procedure manual. There's your proof that you are not on the OIG exclusion list. Now, I've been to this site many times for my clients, and I'll see chiropractors on the list, and I could tell you one of the most common reasons why a chiropractor's name pops up on the OIG exclusion list is because they've defaulted on their student loans. They didn't pay back their student loans, so they are excluded from treating Medicare patients. I mean, You can put in providers that you know have been in trouble. You'll see their name will pop up. So this is a requirement. You have a policy to curb Medicare fraud and abuse. That's your policy. You want to curb Medicare fraud and abuse. What's your procedure? Going to do background checks. Let's do another one about a compliance concern. A compliance concern. So what does that mean? A patient can come in and say, I think you violated my HIPAA rights. So what's the policy? We will institute a process for investigating all good faith compliance concerns. What's the procedure? Here it is. Boom, boom, boom. Compliance concern will be identified by the compliance officer. The compliance officer will conduct an investigation. The compliance officer will complete the incident report form. If necessary, in consultation with the owner of the practice, the investigation might involve hiring an attorney. The compliance officer will communicate the results of the investigation to the business owner and attorney if retained. The disciplinary process will be initiated. The compliance officer will be responsible for maintaining the documentation of the investigation. The documentation will be kept in a compliance file binder. That's your policy and procedure binder. Documentation of the process will be kept in the employee's personnel file. Compliance officer will maintain the documentation. You see, you have written policies and procedures. So if you're ever accused of something, of some wrongdoing, you could say, whoa, time out. Yeah, things could happen, but you did everything right. Disciplinary actions, policy and procedure number 1.3. It's good to number these, so if anybody comes knocking on your door, you could say, well, refer to policy 1.3, 1.2, 1.12. What's our policy? We will not tolerate willful compliance violations or knowledge of any violation. We promote fair and reasonable applications. We may need to immediately terminate an employee once the violation is discovered. That's your policy. Your procedure, violations will be thoroughly investigated. Knowledge of a compliance violation and failing to report the compliance violation will be treated the same as if the person actually did the violation. See how important that is? Our disciplinary actions include verbal acknowledgement and warnings and written entries into the employee's personnel file. Now here's some, other things that maybe you could relate to a little bit more, like if you do laser. You should have a little policy and procedure on laser. Something like this. We utilize laser therapy in this practice. The device we use is FDA approved. Most health plans do not consider laser therapy a payable service. Therefore, we provide an affordable self-pay rate. How about those of you that have open adjusting rooms? Some of you have physical therapists that you employ that you're in an open therapy room. What's your policy on that? Have a policy. See, we have all these policies for just about every situation in a chiropractic and physical therapy setting. So here's one that I created for my clients. Here we go. We utilize an open adjusting therapy room. We make good faith attempts to keep our conversations at a low level. We offer every patient the opportunity to be treated in a private room if requested. Make sure you have at least one room with 4 walls and a door for some patients that don't like being in a open setting. And then other things that you should be, just planting seeds in your head to start putting these things together. Just a simple form. Here's a very simple form that every employee fills out. It's an acknowledgement form that they've reviewed your compliance plan. It says, as a condition of initial or continued employment, every employee is required to review the ABC Chiropractic Center compliance plan. Every employee shall sign this acknowledgement indicating he or she has reviewed the plan, had the opportunity to discuss the plan. Failure to sign the acknowledgement could be grounds for termination. Employee acknowledgement, I acknowledge I've reviewed the compliance plan. I acknowledge that I understand the compliance plan. I agree to follow the compliance plan and report any violations. Everybody has to sign one of these. Even the owner. Yes, the owner, the business owner of the practice needs to sign one of these, and you put it in your compliance manual. Here's another one. You want to name someone a compliance officer? Here's just a simple form that the compliance officer is taking on the responsibility. Compliance officer will update internal policies, have a thorough understanding of the business. Compliance officer acknowledges they've reviewed the responsibilities, they understand and agree to follow the compliance plan. Have them sign one of these, some basic simple forms. And then, part of OIG mandated compliance is doing internal audits, doing a little test on yourself, looking in the mirror, so to speak, and putting together a little evaluation of your notes. So you should put together something that allows you to go through a checklist. This is a chart audit tool that I put together. So you take out a chart, you look at the chart, and you go down the checklist. It's an excellent tool to help you, grade and score yourself. The way it's set up is there are about 30 questions, and out of the 30, some won't apply, so maybe 25 apply. And let's say you answer yes to 20 out of the 25, then you do a little calculation and you get a score. So there's some of the basic things about OIG compliance. And now let's talk about preventing problems. That's what chiropractic is about, right? If you think about, what does a chiropractor do? I don't think of chiropractors as treatment of severe back pain. I look at chiropractors as looking at the entire patient, giving them recommendations on how to make their life better, and preventing problems. At least that's what most chiropractors preach. So I preach the same thing to my clients. You want to prevent problems. You want to prevent errors, fraud, abuse, staff members from doing the wrong thing. So what do you do to prevent problems? Well, you need to be proactive. You can't just wait around. Why? Because Medicare and your state board and all insurance companies expect you to know. You can't say, I didn't know, nobody told me. That doesn't work. Ignorance of the law doesn't excuse you from the law. And if you don't know and you say, well, I just didn't know, somebody told me that many years ago and I've just been doing it, you could be accused of willful neglect. That's reckless indifference, intentional failure, something about you knew or should have known, but you didn't do anything about it. So you want to take the right action steps to do some of the basic things. So some of the basic things: have a good HIPAA notice, do the proper delivery of the ABN form, establish protocol for active treatment, read your local Medicare guidelines, read the chiropractic policies from all the health plans you bill. They're not hard to find. You can find them pretty easily. Now, members of Target Coding, we give them to you. It's part of your membership. But even if you're not a member of Target Coding, just search chiropractic policy Cigna, Aetna policy on chiropractic. Look at them. Review them with your staff. Have a staff meeting on the chiropractic guidelines from the insurance company you bill. Let's say you bill Blue Cross Blue Shield, and Blue Cross Blue Shield in many states has a relationship with ASH. So read the guidelines and go over them with your staff. What should you do? Log that in your training manual, your office policy and procedure that you had a training on that. Attend seminars, attend webinars, watch videos, read books, get your data reviewed. I would recommend you get your data reviewed with a certified coder that specializes in chiropractic. I think 5 years of experience is a good idea. That might be, it might be hard for you to find somebody with 5 years of experience reviewing chiropractic notes, but try and find somebody with chiropractic experience. And a chiropractic OIG compliance manual can definitely prevent audits and payment recoupment. So, just a few closing comments. You must check with all the carriers you bill prior to submitting claims based on the information provided in this presentation to ensure that it is compliant. Target Coding does not guarantee that this information will guarantee payment from any insurance company or patient. Not responsible for any changes that may occur. Changes occur all the time, so stay on top of these changes. Attend seminars, webinars, join your national and state professional associations. I'm going to get to the questions in a minute. First, let me just go over a couple of other things here with you. Well, you probably guessed this. Target Coding offers a OIG compliance manual. How convenient, right? Yes, we do. Very important. We've put together, I think, the best chiropractic OIG compliance manual in the profession. What it includes is a comprehensive, customizable OIG manual, all the policies and procedures personalized for your practice. We give you the chart audit tools, all the corrective action plan guidance, all the sample forms. We have a whole bunch of sample forms on release of information, compliance officer, training, background checks, attestations. I have a whole bunch of those. So we offer that. Let us know if you're interested. We also offer a HIPAA compliance program. Now, HIPAA is totally different than OIG. What's OIG? We just went through it. The purpose is to prevent billing and coding errors, prevent fraud and abuse. HIPAA is about protecting patient health information. It has nothing to do with billing insurance. It's about protecting patient health information. So we have a HIPAA compliance program, which is a federal law, which is required. It's not mandatory. A lot of I would say 95% of the chiropractic profession does not have a HIPAA compliance program in place. And for the last, HIPAA's been around 20 years. The first 18 years it wasn't a big deal because nobody was enforcing it. Now it's enforced. Take a look at any chiropractic journal now. Chiroeconomics, Dynamic Chiropractic, American Chiropractor. Every journal, every newspaper, every chiropractic magazine talks about how the HIPAA police are coming. So I want to get my clients ready for this knock on the door, so we put together an amazing HIPAA compliance program. It's different than most others. This is a concierge type of HIPAA compliance program. It's a premier. We do most of the work for you. So if you're the type of chiropractor that maybe you do your own taxes, or if you buy a barbecue in Home Depot and you want to put it together yourself, put together your own HIPAA compliance program. If you want somebody to do it for you, you want to get the red carpet treatment, then our program is for you. It's not for everybody. It's for doctors that really want to take it to the next level. It includes a cloud-based portal. All your HIPAA policies and procedures are in the cloud, and at any time you could extract them and put them on your hard drive. You could print them out and put them in a 3-ring binder. So it's not like they're in the cloud and you don't have access. You could do whatever you want. They're your policies and procedures. We just store them in the cloud so you could access them from anywhere in the world. We have training videos. I don't know any other HIPAA compliance program out there in the chiropractic profession that has these intense, comprehensive training videos. We also offer HIPAA compliance testing where you get a nice little certificate. And guess what? Our HIPAA compliance program includes OIG. You see, the opposite is not available. OIG does not include HIPAA. But HIPAA includes our OIG, and it's only for a limited time. So just a couple other things. We have a book. This is a terrific book. I think it should be part of your library. It's a book on the best chiropractic ICD-10 and CPT codes to improve reimbursement. We have this nice little chapter of the book where it gives you the diagnosis, and it gives you the chiro, ortho, neuro, and imaging tests to support the code. For example, if you're going to diagnose a patient with cervical brachial syndrome, do Wright's, do Adson's, check for myotomal weakness. We also offer these quick guides or cheat sheets in the book, and frequently asked questions like, here's a common question I get all the time, Marty, what's the difference between radiculitis, radiculopathy, and myelopathy? What's the difference between cervical brachial syndrome and cervical radiculitis? So we have a whole section on that. We do seminars all over the country. Check our website for our updated seminars. We also offer memberships. Here's our basic membership. This is pay-as-you-go, $99 a month. Stop and start at any time. For those of you that want more advanced hand-holding and comprehensive trainings and videos and ongoing support, go for our Gold membership. Would you like an on-site visit? Go with our Platinum membership. Here's our contact info. Email info@targetcoding.com. Website, targetcoding.com. Telephone number, 1-800-270-7044. Fax number, that's our HIPAA secure fax number, 1-844-831-2347. So I want to thank everybody for attending this presentation.